Introducing the African Diaspora News Channel app, your gateway to stories that's overlooked by the corporate mainstream media.
And we serve as the voice to the Tubal Black community.
Again, we got Dr. Candace Matthews.
A lot of these documents, looking at.
We are committed to informing and educating through the power of media.
This country is supposed to be about the land of the free for all. It has not been free for Black people, and we are tired.
With our platform, we're helping to end injustice by exposing it.
Join us in standing for excellence in journalism and serving our community. Download the African Diaspora News app today.
We cannot afford to trust WHO, were the words Dr. Wahome used while addressing Uganda's President Yoweri Museveni. Let me show you this clip. We'll come back and discuss.
Your Excellency, General Yoweri Museveni Kaguta Museveni, President of the Republic of Uganda, and the distinguished guests, it is indeed a pleasure to be here again to discuss matters of national importance and matters of importance to the sovereignty of Africa. This time, our concern is WHO. WHO has been the cornerstone of the advisories on medical care in Africa for a long time, and WHO has done many good things for us. But WHO is also doing some very bad things that I would like to bring to your attention. There is an international health regulation of WHO that is what WHO uses to guide in the management of pandemics. And there is a proposal to amend that document, Your Excellency. And the amendments so proposed are going to convert WHO, which is an advisory body that is run by bureaucrats who are not elected, into an administrative authority that will have power to usurp the sovereignty of member states in case the Director General simply says that there is a pandemic. Now, the negotiations for that international health regulations plus a new pandemic treaty are currently going on, and there will be a meeting this month, actually we are in, and the negotiations have been headed by the Ministry of Health technocrats, ministers of health, ministers of foreign affairs, and ambassadors, and I'm not sure that they are briefing the executive and the parliaments in the different countries, yet they are negotiating things that can destroy the sovereignty of Africa. We cannot afford to trust WHO anymore, Your Excellency, and I'll just mention a few things that have caused great concern to us. In 2014-2015, WHO brought tetanus eradication campaign in our country. It was a campaign to eradicate neonatal tetanus, babies who are born who eventually get tetanus. And the vaccine that was used is a different type of a tetanus vaccine that is a fertility regulating vaccine, where they take tetanus and combine it with a hormone called human chorionic gonadotropin that supports pregnancy. And when you inject a woman with that vaccine, she produces antibodies against that hormone and therefore is rendered sterile. So we are noticing an increase in the number of infertility cases among young couples who you examine and they are normal but cannot get children, or couples who are losing 3, 4, 5 pregnancies before they can carry any pregnancy to term. We were able to expose this, and we have even published a paper that is available. And fortunately, in 2017, WHO said Kenya is now free of neonatal tetanus, and they left our country. But they developed this vaccine over a 20-year period of research from 1972 to 1992. And they used that vaccine in South America, and it is possible it has been used in many other African countries. The second reason we cannot trust WHO, Your Excellency, is malaria. UK was able to eradicate malaria in 1921. The US was able to eradicate malaria in 1951. And from 1955, WHO has been working on how Africa can eradicate malaria, and up to today, we still haven't been able to eradicate malaria. And now they have proposed GMO mosquitoes. Seems like it's not enough to own seed that is going to be used to make our people poor because of GMO seed. Now they are making GMO, they are proposing GMO mosquitoes that apparently will sterilize the natural ones.
He had some strong words to say. And at the end of it, Museveni seems to receive what has been said. And it's quite alarming, the information that he has disclosed. Some of the information was out there, but not all of it. Well, at least we don't get to interact with this conversation because either it gets taken down or the person that exposed it will end up not being there anymore, or they will change their minds because of all the threats and everything that they receive. So this doctor is basically ringing the alarm, telling Uganda and the rest of Africa what the risks are while taking what the WHO recommends. And he is saying that we should say no before they declare it as a pandemic or an issue that they need to tackle, and every government needs to accept it. Now they've twisted your arm and you can't do much about it. So that is why they are speaking up now, and they are asking for Uganda to support them. And sounds like the president is on board and he wants to also help. We will wait and see if other governments will jump on board.
Introducing the African Diaspora News Channel app, your gateway to stories that's overlooked by the corporate mainstream media.
And we serve as the voice to the global Black community.
Again, we got Dr. Candace Matthews.
A lot of these documents, looking at.
We are committed to informing and educating through the power of media. This country is supposed to be about the land of the free for all. It has not been free for Black people, and we are tired.
With our platform, we're helping to end injustice by exposing it.
Join us in standing for excellence in journalism and serving our community. Download the African Diaspora News